Osteoarthritis is a severe disease affecting the joints of over 250 million people worldwide. There is no cure. Current therapies are limited to painkillers and eventually knee or hip replacements. In osteoarthritis, an essential regulatory protein called interleukin-6, IL-6, is present in excess, leading to inflammation. Inflammation promotes cartilage destruction, pain, and disease progression. Even at elevated levels of IL-6, the patient's immune system does not act against the IL-6 protein because it sees it as part of their own body. As a consequence, IL-6 worsens the inflammation inside the joints. Peptinov has developed a unique approach where the patients produce antibodies against their own proteins, for example IL-6. Using their bioinformatics platform, Peptinov has identified and patented a specific IL-6 sequence or peptide that can trigger the production of anti-IL-6 antibodies in the patient. This peptide is linked to a carrier protein to form a conjugate. When administered in the form of this conjugate, the immune system regards the IL-6 peptide as an external agent and starts producing antibodies specifically targeting IL-6. These antibodies reach the inflamed joint, block the effect of excess IL-6, and therefore reduce the inflammation. This in turn stops disease progression in osteoarthritis. 2 to 3 treatments per year are expected to be optimal to maintain adequate levels of anti-IL-6 antibodies. Following successful animal safety studies, the therapy is now in clinical development. Peptinov's anti-IL-6 product will be the first clinical stage active immunotherapy in osteoarthritis with key benefits in terms of costs and tolerance. Peptinov's anti-IL-6 product is potentially applicable to over 40 diseases linked to elevated levels of IL-6, including other inflammatory diseases and cancers. Learn more at peptinov.fr.